restrictions and guidelines associated with our city. First of all, as I mentioned even on yesterday, but being very clear on today, that the city of New Orleans will remain, a mask mandate will remain in the city of New Orleans. New Orleans is a safer place because of the guidelines that we have had in place throughout the past year plus, and it's a safer place to live as well as to visit. And we want to continue on that trajectory as well as we're getting people vaccinated in our city. We are not where we need to be. 75% will establish herd immunity in our community. And so with that, we'll continue to move forward with vaccinating all of our residents, encouraging them to get vaccinated every step of the way. There are no barriers to getting vaccinated in our city. And we see the results as it relates to 35.8% of our community are vaccinated. But again, we are not where we need to be as a city to begin loosening restrictions around mask wearing. Dr. Vegno will go into more detail in regards to the loosening of restrictions that we will be announcing, or we are announcing this morning, which is really around the gathering size limits. So we're going to move as it relates to outdoor will be 500, indoor 250. We believe that this will definitely accommodate of course, not only residents, but also visitors, as well as our hospitality industry and community, that we're continuing to see the uptick. But again, the balance as we are keeping our people safe, as well as having no barriers to our folks being vaccinated, and other initiatives that we will continue to place in communities and neighborhoods throughout the city to, again, meet our people where they are so that they can get vaccinated. We're also, as it relates to our establishments, retail, restaurants, and the like, we're moving our capacity from 75%, and we're going to go to 100%. Now, we do have restrictions that are in place at the state level that, of course, we're going to be aligned with. We cannot loosen further as relates to some of the establishments, but Dr. Vegna will go into more detail as it relates to that. So, as long as, you know, these establishments are keeping social distancing as well as the mask mandates in place, then they will be able to loosen, as you will hear a little bit more from Dr. Avegno at this time. So thank you again. Of course, I'll be here. We'll go into Q&A, and we'll just take it from there. So Dr. Avegno?
Thank you, Madam Mayor. Good morning, everybody. Well, I'm happy to be here to say that the same indicators we've used for over a year now to guide our restrictions continue to show sustained low spread of COVID-19 in New Orleans. Average new cases, the rate of positivity, and hospitalizations all continue to remain well below the thresholds that we've set. And so for that reason, we will, as the mayor said, be further loosening restrictions for businesses and gatherings in Orleans Parish. To get into those a little bit, starting Friday morning, most businesses will be allowed to open to 100% capacity with distancing and masking. That's very important. That's not changing. As Madam Mayor said, the limits on indoor gatherings will increase to 250 and outdoor gatherings to 500, again, with distancing and masking. Gyms and stadium guidelines will largely remain the same, as these settings do pose a higher risk of transmission, but there are some nuances in there that we are working through, and we'll be in contact with some of those relevant entities. As Madam Mayor said, the mask mandate will remain in place. As a reminder, there is no national public health organization or leading experts that recommend the full removal of masks right now. While full vaccination is needed for the pandemic to end, continued masking and distancing mitigates the degree of illness and death until we reach that point. Masks are simple, masks are effective, they are easy, and they protect not only the wearer, but they protect the entire community. And I think we've seen that time and time again, and there is a wealth of evidence that supports this. So with these changes, New Orleans will be the most open it has been since the pandemic began 14 months ago. With that brings more risk. As a state, Louisiana continues to rank among the highest in percentage of variants and lowest vaccinations. Those are two opposite directions from what we would like to see. And we only need to look at places both near and far, like Michigan, Oregon, Brazil, and India, to see that the potential for another surge, continued illness, continued hospitalizations, continued deaths is very real. It is not theoretical. So while we're announcing easing of restrictions, I cannot stress enough that masking, distancing, and vaccinated, the three together, are the most important things everyone can do to keep us moving forward in New Orleans on the path towards normalcy. So if you look at where we are with vaccinations, and I love this graphic, thank you to the comms team who developed it, over 40% of all of our residents in Orleans Parish, and if you remove kids who are ineligible, so those under 16, over 50% have received at least one dose of the vaccine, and that is phenomenal. But this level is not sufficient to achieve the community protection that we need, not only to protect ourselves, but to welcome the millions of national and international visitors that come to our city every year that we love to host. So when you get a vaccine, you protect yourself, you protect your family, but you're also helping our community get closer and closer to returning to doing all the things we love and miss in the way that we really want to do them. Vaccines are free. They are available in neighborhoods all over the city. They are available on every day of the week and at different times of the day. And we have free rides to get you there if that's a barrier for you. I want to just mention a little bit about Johnson & Johnson because I know that's been on everybody's mind. FDA, CDC did absolutely the right thing to take the risk seriously. If anyone has any doubts about the rigor of science and how important it is to really understand and evaluate safety and risks and benefits, I hope that clears it up. Reviewing all of the data that they had, the risk of a severe outcome with Johnson & Johnson is incredibly small, and in fact, much smaller than the risk right now in America of dying from COVID, regardless of your age status. So we welcome the analysis, we welcome the findings, and we welcome the fact that we now have that third vaccine back in our toolkit. We have been doing education around this. In fact, you'll see a video soon on our social media platforms with a local expert in hematology and oncology who deals with blood disorders, who's going to talk about it so that everybody can get more information. We have begun using Johnson & Johnson again. We had two events yesterday that we were really excited to see. Folks were glad to have Johnson & Johnson. We do plan to have more than one choice, and I think a lot of our partners are doing the same because we don't want to turn anybody away who's there for a vaccine. But a lot of folks really just wanted to ask questions, get some education, and then many of them felt very comfortable getting Johnson & Johnson. So we're excited to have that back. In general, we're continuing to do everything we can to break down barriers and bring the life-saving COVID vaccine to our residents. And it is life-saving. Just yesterday, the CDC released data showing that it is effective at preventing hospitalizations among seniors, who again are our most vulnerable group, at 95%. That is tremendous in a population that has suffered horrendous rates of death. So they are life-saving. We've administered over 200 million shots in America, 2.5 million shots in Louisiana, and more than 160,000 shots in our city. If anybody is waiting to see how it's going to turn out, I think 200 million people, that's a lot of people to go first. So if that's the hesitation, I hope that that's enough to make you feel more confident. Now's the time to get the vaccine. We are on the right path thanks to the dedication and the compassion that our residents have shown each other and have shown our visitors. Just like in a marathon, though, it's that last mile that is the most critical and that determines success, ultimately. So let's keep it up. Thank you.
Thank you, Dr. Vagnone. Thank you so much. And Ms. LaToya, I believe, at this time, based on what has been presented, we can just go right into Q&A.
What message do you have to sort of kind of help people who want to get that second dose? People may be hesitant. I know you're opening up barriers, going into different neighborhoods, applying for people. What message would you have for them to make them okay? They may be a little bit nervous getting that second dose.
Well, we're not seeing an issue with the second dose. Once our residents go and get the first, they're absolutely, bless you, on the path to getting their second dose, and they're getting it, which reflects in the numbers. Where we want to focus is on people who haven't gotten the vaccine to go ahead and get it. If we want to protect ourselves, protect our community, protect our culture, preserve it, then it's going to come by way of the vaccination, especially, as we're moving towards, the summer hurricane season, which is expected to be very busy. We're even told that we can see an uptick in May prior to June 1. With, of course, with the focus on going back to school and not having any interruptions in our learning environments that were absolutely impacted over the past year. We don't want to see that. And also, when we look to even festivals and how we want to celebrate, it's going to weigh heavily on how we're getting vaccinated in our community. And so we're wanting to, again, go the extra mile, continue to do that. We're demonstrating that. But we need people to do the right thing and to be vaccinated so that we can reach herd immunity. And we know that visitors are coming. That's fine. We welcome that. But they're also looking to visit a safe place as well. So it's a win-win-win all around. And we're wanting to go that extra mile to get our people vaccinated. It's just that important.
Couple quick questions. What makes New Orleans apprehensive, even more apprehensive to loosen restrictions, as other parishes have felt they were able to loosen restrictions? What is really the main reason why Orleans is deciding to?
Because we're safe. We're safer. We're the safest in the state of Louisiana. And when you look at the country, we're a safe community. And we want to continue on that path. We're not there yet. We're still in the midst of a pandemic. It's having an impact on our economy, no doubt. But if we want to come out of this and be better, it's going to be through the vaccinations. And so social distancing, wearing the masks, all of the guidelines that we've had in place over the past 14 months have really gotten us where we are now. And we want to be better than we are now. We're not settling. We cannot, based on the city that we are, the culture that we're closely tied to, and of course, wanting to be that safe place to live and visit. We can't let up.
And currently, the way things are, so if you were to hold an outdoor event, you could hold starting Friday, you could do 500 gathering outdoors.
You can.
Currently, the way things are, do you expect, and I know it's down the road, do you expect that major events will be able to happen with the way vaccine numbers are going? October's been super busy.
Well, I mean, that's the hope, right? What we do now continues to determine what we'll be able to do later. And so we're seeing unique ways, even with Zurich Classic, right, coming to the community and ensuring, people who are vaccinated were able to have a little greater access. And so just looking at knowing that through the vaccines, it's the best way and it's the safest way for us to enjoy not only events, but to enjoy one another the way that we want to get back to. We're not there yet, but we're wanting to create a level of balance. While we're doing well and continue on that path, we're hoping that that is an incentive, as we're loosening, to be the incentive to continue on the path to doing well.
I'm not sure if this is a question for Dr. Vegno or Dr.
And Dr. Vegno?
Quick question with the events in the, for example, like the Smoothie King Center with concerts.
Oh, yeah, that's a good one.
Events, things like that.
Yep.
It's my understanding, and correct me if I'm wrong, if you go to a Pels game, you could be in a stadium with about
25.
4,000 people
Yep.
or so. And if they were to hold a concert, it would be about 250, couple hundred
Right.
people. Kind of, how were we able to hold
So
that many people in one environment and then another?
So that's one of the things that's changing, actually. So for now, or as of now, tomorrow, the capacity, the percentages will stay the same in a large arena, right? So Smoothie King Dome, big place, 25% indoors, 50% outdoors. But whether it is a sporting event or another event, it will still be 25%. That gathering size limit was taken off. And that actually started with the state. That distinction started with the state in one of their recent changes, so we adopted it. So now it will be the same because those arenas are also working with our safety and permits to have a registration certificate so that everybody knows that the protocols in place for things like Pelicans games are very similar to the protocol, if not identical to the protocols that are going to be in place for a monster truck rally or, a concert, right? We have the live entertainment rules, we have the rules, how they're getting people in and out, how they're spacing people. So that's going to be the same. So that will allow some larger events that are timed and seated and distanced. Does that make sense?
They're doing a great job.
Yeah.
Just the change is, the percentage change for those indoor events would be,
It's the percentage is the same, but the small gathering size cap on non-sporting events has gone away. Does that make sense? So whatever you hold in the Smoothie King Center, as long as it meets all of the other, guidelines about seating and distancing and how you're cleaning and, the other things that go along with a big special event, that is 25%, so 4,000 people capacity. Okay.
And they really have been doing a great job.
Yeah.
what are your thoughts on, like I said, I know it's hard to predict the future, but the Saints have said they're, would love to have that 100% capacity, and I know you don't have a crystal ball, obviously, but is that feasible, from a science perspective, at the data that you're looking at, is that possible?
It is, if we all get vaccinated, right? I mean, sure, of course. It's, if we can achieve a level of immunity where COVID is negligible, again, we know it's never going to be zero, right? But if it is not a threat, if we do not allow the variants to surge, and we look like Michigan, then absolutely, we all want to be 100%, every one of us, me included, of course. So yeah, I think it's completely doable. We all need to recognize this is if this is our shared mission, right? Then whatever motivates us, we need to work towards that.
Clarifying just real quick on the question to the dome and performances and such. So the number, it won't be a fixed number.
It'll be the capacity, yes.
And
Percentage.
then, we've mentioned incentivizing folks to get the vaccine, and we understand that the city hasn't released permits for events later in the fall. Are we waiting until the city gets to a specific point on vaccination before we start giving these permits out?
That is a factor. That is a factor, but the biggest one is the capacity of my public safety team to manage these events. One example right now, EMS, hard hit. EMS was hard hit. Responding to this pandemic, being front and center on the ground, in terms of continuing to serve our public, but our medics also dealing with COVID, and then the lingering impacts of COVID, EMS is hard hit. And so it's a concern, but it's not just looking at public safety through one agency. It's looking at public safety through all agencies, which are essential to keeping this city safe during an event. And our city is second to none when it comes to managing large events. But that's because of what the strength of our public safety team brings to those events. And so that's what it will be about. In addition to that, we're still in a pandemic. The economy is still suffering. That means that the resources to operate government, we're still suffering. So all of these things play a role on what we will be able to do later. But of course, gathering and, without those, it's going to be through the vaccines. But there are other matters that I have to consider when you're thinking about, events as well. So it's not a tunnel vision. We have to look at the whole and the bottom line. And I've already, I've mentioned this, I've already relaxed or provided resources for overtime, all these things, remove furloughs, all these things. But it's still contingent upon waiting for us to receive resources from the American Rescue Plan. When that happens, also the $70 million that we were not reimbursed for public safety, but yet expenses were approved. So all of these things matter and will have an impact on how we're able to meet the needs of our community and organizers around events in our city.
As a quick follow-up, it sounds like there is some worry about just the size of the EMS.
Absolutely. The whole thing, because these are people. They're human beings, and their lives matter. And here we're getting ready for hurricane season. So we cannot lose sight, of just all of the challenges that we face in the midst of a pandemic that we've been in now for 14 months. It has taken a toll on our people, absolutely. And what I will also say, and I heard this even from business leaders on my call on yesterday, seems to be just an uptick, in conflicts, Our people on the front line in the hospitality industry, working and serving, are being confronted by, patrons that don't have patience, want to get into a conflict. And that's a problem. So as we're loosening restrictions, as we're opening up as a city, I just want to underscore the need to be kind and respectful. And that plays a role in how we're able to work together and open our city back up, but with the respect and dignity that all of our people need, and particularly those people who have been on the front line serving, for 14 months plus. So thank you all so much. Yeah, thank you all so much.
If I can, will the
Uh-huh.
bar closure at 1 a.m., is that going to stay in place?
Yes, that has to stay in place right now, yes. Because as we're opening back up, there are just other challenges that we have to deal with, and public safety is one of them across the board, which ties into these conflicts, and the need to de-escalate. Get out of your feelings, calm down, and respect, your brother and sister out here, because we all matter. So thank you so much.
Thank you all. I apologize. Is
Oh, no.
dancing still not?
Is what?
Dancing still permitted?
No.
Not permitted, not permitted.
Thank you so much.